Yeah, we're good to begin.
Great. So good morning, good evening, friends, colleagues, and allies. I don't know where you are calling us from, but we are so excited today. Today we have a webinar really launching bold solutions to end child sexual violence, which have been led by 2.0 and Safe Futures Hub. And you hear that a little bit in a moment. My name is Dr. Faith Mwangi Powell, and I'm the CEO of Girls Not Brides, but also a champion for 2.0. So I've been working very closely with 2.0 and all the leaders, about 330 leaders who have been part of this journey, really to fight solutions together. So today the format of our conversation will be, you hear an introduction from Sean, who will be sharing the report from 2.0. You will also hear the next session of the report from the Futures Hub. And then once you hear about the reports from Ashley, who is working with Futures Hub, and then we'll go into some panel conversation. But before we do all that, I would want to ask you to say good morning in the chat and to also tell us where you are chiming in from, to tell us your name and the organization you represent, and if possible, the country or the region you are coming from, because I can see we have about 83 participants, so we are and growing, 85, 86 now. So please let us know who you are, and please put it in the chat. We are also going to have a Q&A session. So if you have any questions during this, please put them on the chat as well or in the Q&A session. We will come back to you and answer those questions at the end of this conversation. We have 10 minutes at the end, but if it can't 8, just put it there and we'll look at that. There are also interpretations. So if you go to the global map, that's why I always see, please speak the language. I think we have interpretation in Spanish. So please look at that. I've seen our interpreters have joined us. So I think you can look at that and see what language is available there. So I've said who I am. So for me, I'm excited about this webinar because it's such a pivotal moment. I suspect many of you were in Colombia late last year at the pivotal moment of the global efforts to end child violence on the first ever global ministerial conference ending violence against children. We actually broke the World Guinness record, and I was so excited to be part of that conversation. But why are we here? Why are we even talking about this issue today? Because 1 in 5 girls and 1 in 7 boys globally experience sexual violence before the age of 18. So this is what is at stake as we talk about this. And it's important to do that. But I want to underscore the important work where we are using evidence, using our expertise as leaders to come together and mobilize action and funding so that we can end sexual violence against children. So we have a very ambitious agenda as a collective, if I can use that word. So before we even start, I want to acknowledge great partnership between Safe Futures Hub and 2.0 in identifying solutions. And to this end, they have produced 2 reports, and there are 2 initiatives. The first one, which has been led by 2.0 with Sean as the executive director, has been an initiative to help the global community of individuals and organizations working to end child sexual violence to align, and this is an important word, to align around the shared vision and understand the barriers that frustrate progress. Frustrate is another important word because there are so many barriers which frustrate our progress and help break down some of the silos and also really bring some solutions to this issue. So Sean will be talking about a report we are launching today. It's a roadmap to ending childhood sexual violence. And as I said at the start, it's a collaborative framework developed with over 330 global leaders. And I was part of that process. So I can tell you this is true. We had many conversations from across the world, many days and many really, really insightful conversations. And I think what I took away from those conversations is the power of what we can do when we work together. The second initiative, and you hear from Ashley, who I'll also introduce briefly, and Ashley is working with Safe Futures. This is a joint initiative by Together for Girls. We Protect Global Alliance, SVRI, to mobilize knowledge, include underrepresented perspectives, bridge evidence gaps in low and middle income countries, and we'll be launching the Building Safe Future Solutions to End Sexual Violence. It's a comprehensive evidence review. And as you all know, evidence is absolutely useful because it's the one which can help us drive change. So we have a very tight agenda. We have 1 hour for this session. We wish we had more time. So I'm going to not delay. I'm going to invite Sean. And Sean, you have 10 minutes to tell us and to give us an overview of the vision and the roadmap detailing pathways to end sexual violence against children through survivor-centered approaches and system change. Sean, you have 10 minutes. If you can do it shorter, we would all appreciate, because I think time is a precious currency in this webinar. So I thank you and I invite you to really share that. And please listen, participants, please listen well, raise any questions, and then I'll hand over to Ashley after that. And then we'll go to our panelists. Thank you, and over to you, Sean.
Thanks very much, Faith, and what a wonderful introduction. So I'm here today to publicly launch the Vision 2.0, the 2.0 Initiative's report, scoping out and setting out a framework and a pathway to end childhood sexual violence. To do that, I'm just going to share a couple of slides, if that's okay, and just give you a quick introduction to the process, why 2.0 started up, what we look to do, and what we found in terms of our consultations and discussions with many of the people on this call and many other members of our field and our community, all of whom are working to end childhood sexual violence. So why did 2.0 start in the first place? Well, why we started is we wanted a world where all children can grow up free from the threat of sexual violence. So that was our, if you want, our North Star for this whole process. And we know that despite exceptional leaders working day in and day out on this issue, and despite a growing evidence base, this issue of childhood sexual violence still continues to attract a sense of fatalism and taboo. And we also know, if we're being honest, that at times our response as a field can be somewhat fragmented. We think that there is that doesn't have to be the case, that in fact, by coming together to build a shared vision of the future, we'll be more able to effectively realize that vision of a world free from childhood sexual violence. Because we believe that a vision can show how the sector can begin to address the lack of resourcing, which we know and we all experience in our daily work, and how we can put more emphasis on long-term work and solutions, and how we can start to really focus on addressing root causes. Our starting point is that childhood sexual violence is preventable. We do not accept that this is an inevitability. And so the 2.0 process was really about bringing our community together to talk together, to think together, to imagine a dream together about what ways we can collectively work to bring this to a solution to end childhood sexual violence. How did we do that? Well, as Faith said, we had a deeply consultative process. We talked with over 330 actors from across the sector, and we took a considerable amount of time to really have those conversations, to think about what it is that we all do, what we know works, where the evidence is, and also where we need to fill in gaps, and how we can map a pathways forward to ending childhood sexual violence. Those conversations took over 18 months, including 12 in-person workshops. And really what we saw out of that is a couple of things starting to emerge from these conversations, some very powerful insights that we got from all of our field leaders and stakeholders. Our approach was overall to be survivor informed and to start with supporting children, youth, and adolescents to develop a sense of agency and autonomy that they can carry into childhood. So that was core to all of our work and all of our discussions. And our discussions ended with a strong and sustained push for policy mechanisms and regulation and oversight that will keep public settings and private companies safe for children, including online environments, and also 6 critical pathways or themes and practical steps that we believe collectively, if we prioritize, can push us towards that goal of ending childhood sexual violence. And those 6 themes that we saw emerging out of this conversation are things that we think we can collectively galvanize around and start to focus on as a sector. These themes are not a specific strategy. They are not a specific set of deliverables or objectives that an organization would have, but they're more a field level overview of what collectively we can do together, all of which can then be translated, we believe, into very specific actionable strategies and objectives that we, within our own work and within our own organizations and networks and coalitions, can start to prioritize. And you can see that those themes capture a lot of what we need to do to end childhood sexual violence. We need to start shifting social norms to protect children. As I say, we need to start creating digital spaces where children can play and learn and be safe. We know that this issue requires political will, and we know that that is lacking at the moment. So we need to build that political will. We need to root all of our work in terms of evidence and look at how we can scale solutions that we know work. We need to have accountability among institutions, both public and private. And critically, we also need a sector that is not just resourced, but is united and connected in order to move forward with this work. As well as these broad themes that we saw emerge in this long-term pathway to ending childhood sexual violence, we also saw some really powerful ideas emerge in our conversations around what could be achieved in a shorter time frame, within the next 5 years. We termed these action accelerators, and these were examples of things that we can proactively start to focus on that don't provide the full solution, but accelerate us towards this longer term goal of ending childhood sexual violence. And in developing these action accelerators and starting to capture those in the report, we thought about 4 key criteria that let us determine if something is really an action accelerator, if it's really got that potential to drive change over the next 5 years. And those criteria that we used were that ideas and solutions and initiatives had transformative potential, so they could really shift the dial on a particular aspect of this issue. That this was a clear and compelling moment of opportunity, so the time to act was now. That groups of actors were ready and able to grasp that opportunity, so we had within the field those people ready to make these things happen, and that we could achieve significant progress within 5 years. And those criteria led to 8 ideas that emerged during our conversations. And again, you can see them here. Things such as putting pressure and incentivizing the tech industry to operate safer digital environments, transforming the narrative around childhood sexual violence. A really, I think, strong point that came across again and again about moving away from this narrative and sense of fatalism and despair to one of hope. Galvanizing political activism to really start to generate that political will. Starting to strengthen the evidence base. We know that there's lots of things we know that work, and we've got really strong evidence, but there is still gaps and there is more work to be done. Justice systems that center children and survivors in their work. Funding, evolving the funding landscape so we get the resources that we need. Pressure and incentivize institutions to protect children and mitigate harm. So these action accelerators allow us to make that progress over the next 5 years towards those longer term 6 critical themes that we need to focus on that longer journey. And the last thing that emerged from our conversations was the need to strengthen the field itself, to strengthen our sector. And some of the themes that emerged strongly during that were to invest in capacity and leadership. We know the work that people do, and we know that though we have exceptional leaders, but they need support and they need our training, they need mentoring, they need resources, they need to be able to take care of themselves, they need all of those wraparound supports to be able to be as effective as they can be in their jobs, and they are all exceptional leaders. We need to strengthen our field's infrastructure. We need to have more capacity within the field to act. We need to be better at campaigning. in order to generate that political will, in order to hold institutions to account. And we need to focus on root causes. So within the 2.0 report that we're launching today, all of these are captured, and you will, when you read the report, you will be able to see all of the nuance and the details of those conversations and the powerful insights that we were able to generate from this fantastic community of 330 stakeholders. But we know that a vision and a roadmap on their own won't change the landscape. We know that this document is not an end in itself. It is merely a beginning. What we need now is commitment and engagement from governments, public and private institutions, private donors, and media to really embrace our vision for the future and work with us on building a world free from childhood sexual violence. And as we continue this journey, and as we get to work with all of these exceptional leaders on this call and around the world who work on this issue daily, we in 2.0 will also do our part. We will work to continue to strengthen relationships among actors in the field by bringing communities together. And we will also support the field by fostering powerful communication, storytelling, and ongoing learning. So that is our commitment back to the field. I would encourage everyone to go and read the 2.0 report. It is launched today. It is available now on our website. The link is there. There's also a QR code you can scan if you would like to see the report. And as part of this bringing the field together, we are going to have a community gathering later in the year, in the autumn, where we will look at how the field has reacted to this vision that we've just launched today, that we will discuss where we go to from here as a field. That community gathering, as I say, will be happening in autumn, and we are extending an open invitation to everyone in this call and any stakeholders in the field who would like to continue this conversation with us to join us at that community gathering. The way you can do that is by registering your interest at the bottom link there. And again, QR code will lead you to that link. The last thing I would say is I just want to express at this point our very deep thanks and appreciation to Oak Foundation, the Indigo Trust, Phillips Foundation, and Ignite Philanthropy. None of this work and none of all of that we were able to do, and this very powerful vision for the future, this collective vision, which isn't ours, but which is the field's, which is all of the people who contributed to this conversation. All of this would not have been possible without their deep and generous support. So thank you for that. I will finish by saying this is our moment. We are at a moment where we can imagine a future free from childhood sexual violence. We have the ability to do this. It will not be an easy road. It will take time. It will take effort. It will require all of us coming together and working cooperatively and collaboratively. It will require all of us encouraging others outside our field, but also pressurizing them to step up to the mark and do their job in protecting children. But it is possible. Our fundamental starting point into 2.0 is this is not inevitable, this is preventable. And we know that together we can make a world safer and more joyful place for children. Thank you very much.
Oh, thank you, Sean. What a wonderful way to kick off our webinar today. And I'm sure I've seen so many hearts, so many claps, so many celebrations for this work. So thank you, great participants. I know there are 145 participants now. And the word I want to take away from Sean is accelerate, accelerate, accelerate. But also, it's our moment now. What is your sphere of influence? There was a call of action. What is your sphere of influence? How can you do this? The slides, the report will be sent. In fact, it's already on the chat. Please download there so I can see questions, people asking for that. This will be shared with you. But let us know if there's any other way we can do that. So moving very quickly, and Sean, you have set a very high standard. You've kept time and given me maybe 1 minute, which I'm already using. So I'm just going to move quickly to Ashley Howard. She's a senior manager, data, evidence, and policy at Together for Girls. And they've been collaborating with Safe Futures Hub to highlight some of the evidence and looking at what are the effective prevention and response strategies, particularly in low and middle income countries. Ashley, you have 10 minutes. If you can do in 9 or 8, we would really appreciate. And please tell us where we can also find the report as you conclude, and specifically also what you are asking us to do as participants of this webinar. And for the participants, please remember to put your name, where you are from. I can see we are from many, many continents right now, but please continue telling us who you are. Over to you, Ashley.
Thank you so much, Steve. Thank you for your amazing work. Thank you, Sean, for leading so nicely into this presentation. I think your evidence and roadmap ties so nicely into the roadmap, into our Building Safe Futures evidence review solutions to end childhood sexual violence, which I'll be talking about today. I'm a senior manager for data evidence and policy with Together for Girls, which is one of 3 lead organizations for the Safe Futures Hub, along with We Protect Global Alliance and the Sexual Violence Research Initiative. So the Safe Futures Hub works to prevent childhood sexual violence by uplifting diverse research, as well as practice-based knowledge and survivor-informed knowledge. And if you don't remember anything else, I'd like you to remember that we know what works to end childhood sexual violence. We have the evidence, we have the solutions, and we need to implement those effective solutions now. So the heart of our mission at the Safe Futures Hub and in our Building Safe Futures evidence review is to mobilize knowledge. And you'll hear more about the evidence review shortly, but we've tried to ensure that the latest evidence, especially from low and middle income countries in the global majority world, is accessible, practical, and ready to drive change. But note that this is just one of many upcoming initiatives within the Safe Futures Hub. So in developing the evidence review, we have taken a highly collaborative process similar to that which Sean explained earlier in the 2.0 work. We have built upon the 2019 What Works to Prevent Childhood Sexual Violence report published by Together for Girls, and we engaged with more than 40 members in an advisory group, stakeholders from all over the globe who overwhelmingly told us that one of the most critical needs to prevent childhood sexual violence is an understanding of evidence of what works and is adaptable in the global majority world. But we fully recognize that this is a global issue, and our upcoming work will also expand to highlight evidence from high-income countries this year and how that will be adaptable to low and middle-income countries. So our approach to this review includes sourcing literature from diverse sources of academic evidence. We had strict criteria for inclusion, including timeframes and outcomes variables. We categorized evidence by Inspire strategy, which I'll explain more about in a few moments. And we grouped all of the different programs for which we looked at journal articles and white papers by various intervention types. And then we classified the evidence by effectiveness. So for anyone who may not be familiar with the Inspire framework, although I believe you all must be, the Inspire framework outlines 7 evidence-based strategies to prevent and respond to violence against children. And we have organized our interventions by each of those strategies. So you can see on this slide, overwhelmingly, the most evidence and the most literature that we reviewed was programs related to education and life skills for children, followed by parent and caregiver support. Very few actually looked at response and support services. So we can already see some gaps that also need to be filled by our community. I'd also like to highlight a map of the locations for which we brought evidence into the evidence review. You can see a good spread of countries in the global majority of the world. You can see that there are still gaps in representation, but we do believe that this evidence review shows that we know what works in much of the low and middle income countries in our world. So I'd like to highlight for you some of the effective intervention types. When I say effective, I mean that they were supported by a number of high quality studies that showed evidence of impact in actually reducing experiences of sexual violence, direct experiences of sexual violence. So some groups of interventions or intervention types that had multiple effective solutions included adolescent development clubs, skills development for preschool children and parents, parent skills for preventing childhood sexual violence in adolescence and pre-adolescence, cash plus interventions targeting women and adolescent girls with economic strengthening, broad prevention modules in school curricula, self-defense intervention for sexual violence prevention, as well as educator training for developing prevention models for childhood sexual violence. We also had a number of promising intervention types. These may also have had high quality evidence, multiple studies demonstrating effectiveness in different programs. However, they may not have shown direct outcomes related to sexual violence. They may have been more closely related to norms and values. For example, these include small group interventions for children and adolescents outside of school, parent counseling approaches to preventing childhood sexual violence, cash plus interventions directly targeting adolescents, and child and adolescent friendly response and support services. Then we come to prudent intervention types. These are really critical types of interventions that mainly relate to legal frameworks, maybe recommended by global treaties, but are really hard to measure with empirical evidence. So we call them prudent because we think they're really important, and they're clearly really important, but difficult to get that evidence base. These include domestic legislation, national action plans, especially related to online sexual violence, child-friendly justice systems, international safeguarding policies and approaches, and school-based prevention interventions for children and adolescents with disabilities. We also had a couple of types of interventions that were conflicting, where some evidence looked really promising and other evidence may have shown some degree of harm. These included child-friendly spaces in humanitarian settings and school-based interventions to prevent harmful or problematic sexual behavior by children and adolescents. And then we highlight a number, unsurprising, of types of interventions that need more evidence. These include media and tech assistance norm change campaigns, sports-based interventions, evaluating safeguarding systems, savings programs, and screening, reporting, and disclosure of childhood sexual violence. So I'd love to highlight just a couple of the incredible programs that appear in our evidence review. One is parenting and support, caregiver support intervention called the Parent App, which has been implemented in Mwanza, Tanzania. It engaged 4,800 caregiver adolescent pairs in a sexual violence enhanced version of the Parenting for Lifelong Health program, with both in-person sessions and an offline app that contains multiple different modules to engage parents in behavior change strategies. It also put parents in groups of 50 or more people within WhatsApp support groups, and it demonstrated increased adolescent and caregiver gender equitable norms and behaviors and reduced rates of past month sexual violence, just to highlight a few key findings. Another example is in response and support services. One example of this is the mobile approach for developing services to Syrian refugees and refugees in Lebanon. Let's see. Another key intervention was in the education and life skills intervention type, the Deaf Kids Defenders program, which was conducted in South Africa, showed that it was a really promising intervention to help children suffering with disabilities, piloted across 10 schools, in Pakistan and South Africa, training for teachers and other session leaders, offline and facilitated sessions and online activities. And it showed that it did improve children's knowledge and safety measures and highlighted the importance of tailored, inclusive education strategies. And after participation, more than 90% of children demonstrated increased knowledge and application of key safety messages after the intervention. So we know that we have many remaining challenges. Sean already highlighted some of these, including coordination across sectors, monitoring and evaluation gaps, issues of service delivery, societal and cultural barriers, and research and evidence gaps. And our review goes into quite a bit of detail about what practitioners and researchers can do to fill in these challenges and gaps. But again, I just want to remind us that we know what works. There are really effective solutions. There are effective solutions in the global majority world, and we are on a mission to elevate that research. Please do find our report, read through it. We want to thank Oak Foundation for support for making this work possible, as well as the many child protection organizations who endorsed our work and provided feedback on it. Thank you. Back over to you, Faith.
Thank you so much, Ashley. And again, you can scan the QR code to get the report, but also this report will be available and can be sent to you. And again, amazing. Thank you so much, Ashley. I'm seeing people far-flung from Australia, Bangladesh, Kenya, Nepal, Malaysia, Nigeria, Sweden, Childhood Group. We are so excited. Continue telling us who you are. Now you are going to hear from some of the experts we worked with. And this is just really a sample of some of the people we worked with. Raven Sivashagpan, I might not pronounce your name really well, Raven, but I hope you understand. Pooja Taparia and Steve Crump. The bios of these speakers are going to be put on our chat. They have already put before, they can be put again. And I just wanted to ask, starting with you, Raven, what are your takeaways from what you have heard from Sean and what you have heard from Ashley? I'll start with you, and you have 2 minutes, please.
Gotcha. Hi everyone, my name is Laven. I work for Monsters Among Us, an organization from Malaysia, which focuses on youth-centric, survivor-centric support for survivors of childhood sexual violence. Generally, my main takeaways from the report is that a lot of what they do is in line with what we are trying to do in MAU as well. For example, we kind of focus on, we use the UNCRC, the Convention of the Rights of the Child, as our guideline. So we care about child rights and child participation. We care about comprehensive sexuality education. We care about CSA, and we care about harmful practices such as FGMC, and child marriage. So with that in line, we care a lot about centering survivors in the sense that we've had a chatbot in which we allow children to pass on information about, but essentially their experiences with CSV. And from there, we help guide them to the child protection system, allow them to make their own decisions, decide what kind of help they want. Do they want do they want to engage with the police? Do they want to engage with counselors? More than anything, we just want to provide and facilitate the way forward for them, not decide anything for the children in the first place. And that's something that we really care about, which is very much in line with the report as well, on centering survivors, in this case, centering children and allowing them to make their own decisions on what care they want.
Thank you so much. And I also want to acknowledge you stepping in at the last minute. I know Fasana, your colleague, was supposed to be here, but thank you. And thank you really for sharing those. Really, I think the child-centered response is literally the way to go. So we really appreciate that. Pooja, you've been a champion. You have accompanied us in this journey as champion, as an expert with the 330 leaders. Way back when we met in Cheshire, the first meeting, how does this moment feel for you, and what are some of your reflections and some of the takeaways from what you have heard today?
It's wonderful to be here, and I'm so excited that, we've launched the 2.0 vision, something that we've worked towards over the last 18 months. So I'm feeling extremely happy. And also, of course, that we're launching the Safe Futures Hub report, which showcases scalable solutions. And that really excites me, because I feel that for the longest time as a sector, we've not had the believability that we can scale or that we can solve for the issue. So the fact that we're launching a report, we're launching a vision that is able to create a pathway and give examples of how can we really solve the issue is just super exciting for me. So I'm really glad that this is happening today, and look forward to getting insights from others and reactions on how this is going to be perceived and understood, and what are some insights that we get from others as well. So really looking forward to it. I think what's common between both the reports, and I just want to make 2 points on that. One, the fact that we're all invested in the issue to grow it, to bring it the attention that it needs, and to keep showcasing great examples from across the world on how we are working to address the issue. And I think the second point that I'd like to make is the need for evidence and more research so that we can all continue to test efficacy, not just keep growing something, but keep testing whether it's effective and impactful or not, and then share those examples with everybody around the world so that we can learn from each other.
Thank you so much, Pooja. Really, really well said and well captured. And Judy from Brunei, we see you. Continue telling us who you are. We are really excited that you are part of this conversation. Steve, we had a very good train ride together from Chess had the first meeting. We met as leaders, and it was exciting to just really share what we had discussed that first day. As you look at this conclusion of the report, what are your reflections, Steve, and what does this make you feel?
Thank you very much, Faith, and greetings all. Steve Crump from Deaf Kids International, and we work globally to respond to the protection and safeguarding needs of deaf children and to ensure that they are safe from physical, sexual, emotional abuse and neglect. This in the communication mode of choice: sign language, scientific spoken language, oral method, or deafblind manual. And obviously and clearly, we have a particular interest in ensuring that deaf children and young people are protected from sexual violence, given that deaf children and young people are 4 times more likely to experience sexual violence than their hearing peers. So to this end, and as you so eloquently described, Faith, we've worked with the To Zero movement and the Safe Future Hubs to ensure that these commendable initiatives are inclusive of the needs of deaf children and also disabled children, because the reasonable adjustments you make to include deaf children can apply to disabled children. And I guess our key takeaway is that this work has to be inclusive, given that 15% of the global population experiences some form of disability, and that rises to 20% in low resource settings. So that's physical disability, sensory, learning, neural, mental health. So, and these incidences occur because of, in many cases, poor neonatal care, greater susceptibility to the childhood conditions that cause disability. So this work has to be inclusive, given that disability, the stigma, the discrimination around this fuels prejudice. It legitimizes sexual violence. I can rape that child because I know they won't tell anybody. I can abuse that child physically because they're worthless. I can get them to perform a sexual act online because nobody will believe them. They've got no one to disclose to. So, this work, this powerful, incisive work, needs to be inclusive, and commendably it is. And I think, the particular takeaway from deaf kids is that in both reports, the 6 accelerators in the To Zero report, the 7 solution tracks in Building Safe Futures, the needs of deaf and disabled children, as Ashley just outlined earlier, have been factored into thinking around policy, prevention programming, survivor strategies, and of course, funding. Funding needs to be inclusive, given that working with deaf and disabled children is expensive because you've got to bring in sign language interpreters, you've got to produce that material in braille content for those with sight loss, you've got to make adjustments, and so funders need to be aware of that cost implication. That's the key takeaway. This incredible work needs to be inclusive, and excellently so it is.
Inclusive. I cannot agree with you more, Steve. Thank you for that really conversation. I'm going to do another round of questions, and please try to make it brief so that we have time at the end for any questions. So I'm going to come back to you, Laven, again. And the framing is that I understand Monsters Among Us, they work community-driven, survivor-led initiatives to break the silence and to address the harmful cultural norms. So my question for you is, what are some of the strategies that have been most effective in mobilizing communities and survivors to speak out? You heard Steve saying that they will not speak out, to speak out and to take action. And how do you address cultural and societal taboos that perpetuate silence around sexual violence against children? So what are the strategies for mobilizing communities? And how do you address that social norm around silence? Again, you have about 3 minutes, Levin. If you can do that, that would be great.
Okay, so off the top of our head, some of the things that we have talked about as well is child participation or child participatory principles, but that sounds very vague. It can be difficult to operationalize that. But in general, what we believe in is if we're going to have a workshop on CSE for children, for example, then we need to make sure, okay, what do you want to learn? Like we shouldn't decide for ourselves, this is what puberty is about, this is what consent is, etc., etc. What do you, the child in question, want to learn? What do you want to know? Because most likely they already have ideas of things they want to learn, things they've seen on the internet. So we just try to fit that mold, especially when we're trying to create like an educational setting. It's very common for there to be power dynamics, like us the educators, us the people who are facilitating. Our goal is to subvert those dynamics, to create a workshop or a system or a framework of learning, of engaging with children that allows us to kind of flip the script a little. And if, let's say, you don't want to do a workshop, you want to leave, let's leave. Let's try something different. Let's do what you want to do. And it sounds very strange, and because honestly, sometimes the workshops can end very prematurely. You don't actually end up achieving all of your objectives. But ultimately, the goal is just to try and imagine a different way of doing things, of teaching, a different way of engaging with children, giving them the stage to speak. And that's kind of what we're trying to go for, I think. In terms of dealing with taboo in Malaysia specifically, I think a really big part of what we try to do is understand the roots of said taboo, because not only can it be cultural, religious, etc., etc., it can also be socio-economic in nature. So, for example, we saw the evidence earlier about income and economic strengthening. A very big part of child marriage in Malaysia also is that it happens most often in lower income communities. So we also need to understand, why is it that children are treated as commodities in lower income uh, communities, and understand, like, a lot of this is class, a lot of it is class issues, a lot of it is what income, a lot of it is what economics. And there's so much interplay here that looking at it in a silo, in a vacuum, is just not going to work. So that's, I think, the two. We think about taboo, you also have to think about socioeconomics, and that's a big part of what we're also trying to do, and try to have that empathetic lens. Sometimes people just do the things that, it sucks, but they do them, and we just kind of have to understand them first. Yeah. I think you're muted.
I muted myself. Thank you for observing that, and thank you for sharing that and really being very precise. What the takeaway from there is meeting the children where they are, approaching them with the tools and the ways they like to learn. What are they doing now? How can we use what they are doing now? Meeting people where they are. Thank you for that. Pooja, you are the founder and chief executive of PAN, and I remember you sharing passionately how many children you have reached all over Asia, so India specifically. And I know that you implement scalable school-based prevention and support programs for children and caregivers. And I think that caregiver aspect is so important. So my question for you, what lessons can you share about effectively integrating CSV prevention into schools and engaging caregivers in a meaningful way? And I think the point here is a meaningful way, because sometimes we say we are doing caregivers and it's very tokenistic. But I've heard your program you shared so eloquently. Please tell us a little bit more. Again, Pooja, you have about 3-4 minutes. Thank you.
Sure. I'll try to do it as briefly as possible. Thank
you
Faith.
So much.
So Arpan's been running this a school-based model since the last 17 years. And we've trained close to 150,000 children and about 100,000 parents and teachers directly by the team. The way we do it is we do lesson plans with children to help them understand safe and unsafe touches. But most importantly, before that, we train parents and teachers. And then after the lesson plans, we're conducting individual sessions with children to enable disclosures in safe spaces, and then help children heal if they've been through any kind of abuse and stop any ongoing abuse. And the program continues with therapy, and then we do parents and teachers trainings again, and then we move on to the next school. But we go back to these same children in 2 to 3 years to give age-appropriate messaging, check on the children of how they're doing, And they can also reach out to us in case there's an unsafe situation through a helpline number. This is just a gist of what we do. What the learnings have been and the insights is that, one, it's so important to have a model that includes both prevention and healing. I feel that it's really important, especially when you work with young children, giving them spaces to disclose unsafe situations and seek help, I think is critical in an environment where this is not really encouraged. Two, I feel that therapy is a really important aspect that, and healing is a really important aspect so that it doesn't lead to further harm, and that in a way needs to be also looked at as prevention. Two, we've understood is that just doing lesson plans with children is also not enough. We need to work with primary caregivers, such as parents and teachers, empower them because they are with children all the time. The other learning is a one-time intervention or a one-time education program is not enough. Right from children, from pre-primary to grade 12, it's important to repeat the messaging so that they remember and they are able to apply skills in an unsafe situation, because that is success for us. The other thing that I'd like to share is that it's really important to keep child centricity in the center. And that's really been the ethos of Arpan's work throughout. Irrespective of what we might think as adults, what the laws of the country say, the mandates and the protocols we have, I personally believe that thinking about what's in the best interest of that child, I think is really important. And I know that these are complex things to think about. There aren't any easy answers, but the kind of casework we do, we've literally looked at every child singularly and thinking about what's best and be very strategic about it. The other thing I think is that motivated teachers and principals can become amazing ambassadors. We have found people whom we've trained to go on and implement the program, they implement it exactly in the same way, which means that it's easily doable. The important thing is, are they motivated enough? Can we motivate them to take it ahead? Because once they see the value in it, the demand comes. The other learning has been is respecting diverse and opposing views. How can we be perseverant in an environment where some people might not really acknowledge or appreciate the approach? However, we've created an environment where we are listening, sharing our views, and moving on, leaving it for people to decide what's best for themselves. And I think the last thing that I'd like to talk about is having a multi-pronged strategy. I believe the education system is a powerful mechanism to scale prevention and healing work in a very, very significant manner. And I say this because we were able to integrate personal safety education in India's first ever life skills program, which is now reaching over 14 million children. The government is saying it's reaching 80 million children, which I think is just phenomenal. So partnering with the government, thinking about scale, partnerships, curriculum integration for enabling systemic change, because just teacher training by itself is not enough. Just working with a handful of schools is not enough. We need to think scale. We need to breathe scale. We need to live scale. But remembering that where we started from might not be the way to scale. I've learned that with every stage of scale, we need to redesign for scale. What could work for 10,000 children might not work for 5 million children. And being able to be humble enough, going back to the drawing board again and again to do the best, keep testing efficacy, and keep going on that path to reach as many children as we can, I think is the best way that we can do this work. Thank you.
Thank you so much, Pooja. And there is a link to Pooja's work if you want on the chat, if you want to know more. And one of the things I can say, Pooja is such a great collaborator and partner. So if you want to learn more, collaborate with what she's doing, please reach out to her. And thank you so much. Scale, 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 and learning as you scale. I cannot agree with you more. So Steve, I'm back to you again. Pressure to finish at least in the next 3-4 minutes. So my question for you, and you started talking about these issues, Steve, you are working with really, excuse me, addressing vulnerabilities for children with disabilities. So what interventions or innovations have proven most impactful in safeguarding the vulnerable population, especially the children you're working with? And how can inclusive approaches be better integrated into mainstream strategies to ensure no child is left behind? Because that is the mantra. We don't want any child left behind just because of their disabilities. Over to you, and you have about 3 minutes, Steve.
Thank you, Faith. I'll keep it brief. Don't worry. I guess what's the exit strategy here? Well, it's as you just said, Faith. We don't want any child left behind. And I think from deaf kids' perspective, our exit strategy, our exit wish is that no deaf child or disabled child has to experience the agony of online sexual violence. And I mean, how do you scream in sign language? So in terms of responding to your question, I mean, many deaf children we have not been socialized to sexual norms. They lack the language and vocabulary to understand sexual behaviors. They've been denied access to education. They don't actually know what's happening to them is wrong. And so in order to respond to that, we work to develop, as Ashley mentioned earlier, Deaf Kids Defenders, working with deaf children, obviously, and the brightest and best in the games industry to develop that digital capability, a series of digital games aged at children 7 to 12, to empower that constituency, that ordinarily hard to reach group with minimal language, very visual, in an energetic digital way, the mean to say stop, my body is mine, how to understand and stop online grooming, how to reduce your risks to sexual violence, and how to disclose to a trusted adult. We've developed that capacity. The impact has been considerable, and we're now looking to scale it. And indeed, having piloted in South Africa and Pakistan, Deaf Kids Defenders is now being scaled there, and also in Zambia, and this week, I'm delighted to say, Kenya. So, from small beginnings, Deaf Kids Defenders is growing, and we're inviting everybody here on this webinar to be a defender of deaf and disabled children. And I think, looking at mainstream policy, programming, survivor strategies, funding, the key here is partnership, as we see today, working together to ensure that its inclusion is addressed. And To Zero and Save the Future hubs have reached out in this work, as have the other actors, Brave Movement, Detective for Girls, We Protect, Safe Online, World Childhood Foundation. So that community of actors, practitioners, agitators working together can really make a difference, I think, to ensuring the inclusion of deaf and disabled children. Don't stop now. This is just the beginning. Thank you.
Thank you so much, Steve. And you have literally had a snippet of the fun we had when we all met as a group, hearing from all these experts. But now we've been talking at you, so it's over to you. We have a few minutes for questions, and I have seen several questions which have been answered in the chat. So if there is any specific question which has not been answered, but perhaps Ashley, you may want to talk a little bit about the app. I've seen a few questions about the Parents app. If you want to just say very few words while I check whether there are other questions. Thank you.
Sure, I'm happy to. Although I see that Joyce from Wanza is actually on the line. I don't know if we're able to open it up to participants to talk. Faith, is that possible?
I'm not sure. We can ask Arumina whether we can do that.
I can say a few words.
We can do that.
Okay, Joyce,
I don't know if you want to come in and speak.
If you can just briefly, and how to convince parents. I think that is the question which really seemed to be the one really making people kind of nervous. Joyce, are you able to speak?
Yes, I'm able to speak.
Yes.
Can you please just maybe repeat the question for me to get, because I'm trying to scroll through. I don't seem to see it clearly.
So the question was, and maybe Ashley, you can help Joyce, because I saw you are trying to answer that. Go ahead, Ashley.
Yeah. So thank you so much, Joyce. Sorry to put you on the spot, and really appreciate it. I saw you in the chat, so I didn't want to speak for you. But people were really encouraged by the Parent app. I did mention in the chat that the app is meant to be really engaging. You have so many different modules and tips and goal setting, but they're wondering how you plan to make the app sustainable. How do you keep it sustainable in other systems? It's been mentioned that it's really hard to maintain an app like this. So do you have any plans for how to make sure the app will live on beyond sort of the scope of one project?
Yeah, that's really a very interesting and important question. So the way we set up this app was through WhatsApp, and WhatsApp is a means of communication that is very common in this setting. So they have WhatsApp groups that they keep actually engaging on, discussing things related to the app, but also just any other thing that parents and caregivers would actually like to discuss. So as part of the project, of course, we've been providing data bundle every month, which is just 1 GB, and that has kept really people motivated. So looking into the future, we just hope that the groups that were set up, that they set up themselves in the communities, they would sustain them, because this is sort of a means of chatting and communication in this setting. So we hope that they'll continue sustaining this group even after we've actually phased out the project. So, and when I say we phased out the project, we'll not be providing data bundle, but we just hope that they still be motivated to continue engaging. But we are working closely with government as well, with an eye of scaling up the parent app in the whole country, but also in the communities and other areas where they didn't receive the app. So we are hoping that government will take up some of this group and help, just keep the momentum of what has been started. And they'll work closely with the community social welfare officers. We're still exploring other pathways through which we can actually really keep parents engaged as we expand to those who didn't receive the app.
Thank you so much, Joyce, for that clarification. And again, if you want some follow-up, Ashley has shared some links there. Please follow up. And maybe a final one for 1 minute, Pooja. There was a question on, and you kind of mentioned it a little bit, how we approach child centers without re-traumatizing them. And I think you said healing should not cause harm. Do you want to just maybe in a minute just elaborate that a little bit?
Sure. I feel like whenever we try and do any intervention, if it's only an intervention, like we're only trying to stop abuse, but we're not, or we're doing only prevention programs, but we're not creating spaces for disclosures, it can leave children with some form of anxiety, because suddenly for children, understanding that what they've gone through is actually abuse, because for many of us, it was only when we were adults that we understood it as abuse. As children, we didn't even understand that there was a violation that was happening. And so I feel that having those spaces where children can disclose openly, and then if we can provide therapy so that children can heal from the trauma and the impact of abuse, that can ensure that there is no harm that's happening.
Thank you.
In fact, it's actually helping children heal and thrive.
Thank you. Unfortunately, we are running out of time, but I want to thank our panelists, our speakers, our participants, and just say that the key takeaways for us is that importance of evidence. Please look at the report Ashley shared, the importance of unified survivor-centered approach, our Vision to Zero report, which Sean shared, and really concrete examples which have been shared by our panelists. Please follow up if you want some more questions. And thank you for the hearts and the celebrations. And to say that for me, ending child sexual violence is achievable and the moment is now. So I'm having a call to action for all of you. As you have heard, the first thing is that please leverage the findings from these 2 reports, Building the Safe Futures and the Vision to Zero, to inform within your sphere of influence. If you can influence your government, please do. If the only person you can influence is your family, please start there. So don't feel like you are incapable because you don't have a huge network. Identify your sphere of influence and use the results we have found here to really amplify and to call others into that. Let us all advocate, including myself, for increased investment because we can have grand plans, but if we don't have the resources to do that, we are not going to be able to meet those objectives. And let us have the survivor support at the center child-centered response. It's absolutely important. Engage with the reports, amplify, share your work. Please share widely. We want everybody to know about this work because the responsibility lies with us. Support the initiatives which are coming. Be part of Safe Futures Fab to Zero. I have enjoyed being that. And the links have been shared for the report. And finally, please join the mailing list for To Zero because you can get enormous resources beyond what we have shared with you and participate in future webinars. Already Sean talked about a future convening and there'll be more details shared with you. Please, if you did not get that link earlier, which was shared, please reach out. We will share that with you and we'll share as part of the resources from this. I see there are more questions we have not been able to answer. We'll look through them and we'll really collate and answer all those questions. It's been such a joy to be part of this conversation. I know I can't see all of you, but I can hear the energy from your actions, your reactions, the hearts, the celebrations, the claps, the thumbs up, everything. This has been an amazing start of my morning, and you have really set me up for a great day. I hope you're having a great day yourself. Thank you, and it's a privilege to have been part of this conversation. And remember, the moment is now. We are accountable. We must end sexual violence against children. Thank you. Have a good day. Have a good afternoon, good evening, depending on where you are tuning us from. And there's another webinar tomorrow. And maybe, Sean, you can say quickly about that. Has that happened with Daniela? Was it yesterday?
That just happened.
Oh,
Yeah,
great.
yeah, that was yesterday.
That happened yesterday. Sorry, yeah, my bad. So, but I'm just showing you there's lots of things going on. So keep your eyes open and your ears peeled so that we can really be part of that. Thank you. Over to you, Sean, if you want to say a final word.
Well, no, just thank you, Faith, for so wonderful moderation. I think on behalf of myself, Ashley, and all of the panelists as well. On behalf of 2-0 and Safe Futures Hub, just to thank everyone so much for being part of this conversation today. And thank you for all the work that you do. And as Faith says, the moment is now. Thank you.
Thank you. Bye-bye, everyone.
Congratulations.
The report is launched. The two reports are launched. Thank you. Bye-bye.
Thank you. Bye-bye.
Bye-bye.